Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So, friends, as you know, we are discussing about ADHD, and 3 or 4 lectures related to ADHD we have already completed. So today we will continue, and today we will especially going to deal with the treatment of ADHD, which is a very important part. Now, in the last class, we have seen what is actually the pathology related to ADHD. Although pathology is not yet clear, we have estimated that there are some problems related to dopamine and noradrenaline neurotransmitters in the brain. So, the first line of treatment is always a stimulant medication. Stimulant medication means we have to provide dopamine supplementation. Now, it is very important for memory, learning, attention, and focusing. Dopamine is very important. So, there is increased release of dopamine in the prefrontal cortex actually. That means a lot of dopamine related neurotransmitters or neurons are present in the prefrontal gyrus. Because prefrontal cortex, that's very important for planning, judgment, executive actions, abstract thinking, etc. So there we have got more amount of dopamine receptors or dopamine neurons as a that is neurons containing dopamine as neurotransmitters. Now we know that a prefrontal cortex area will be get affected. Volumetrically, it is less in case of ADHD. So we have to provide dopamine supplementation. This is the first line of treatment. Second line of treatment is child and family therapy. Increase the self-esteem, cognition therapy, ask the child to stop and think and rethink, engage in one particular work, try to increase the concentration of the child. So this is a long process and very planned process. The child and family should be involved and physician has to explain the things. This is the second main principles of treatment. Third one is parents training. You have to train the parents also. Many times parents of the such child will don't know what actually they have to do. They are confused actually, and there is a need to teach some of the parental skills also to the parents, set the limits and how to do the reinforcement, enforcement, etc. So that has to be taught to the parents. This is superficially, these are the principles of treatment. Now come, most of the time these kids will attract the others attention for only negative behaviors, and their positive behavior is neglected. This is what actually happens. A child with the ADHD, when you're treating, all the negative behavior of the child will be more highlighted. That child is also showing some of the positive behaviors also in between. Now we have to teach the parents that you have to highlight these positive behaviors rather than highlighting the negative behavior. So this is the parental training what we have to do. Now in the counseling again, uh, counseling, lifestyle changes and parental training, psychotherapy or cognition and behavioral therapy, these are the mainstay of treatment. Okay, one is counseling the parents and counseling the kid. Then you have to bring down certain lifestyle changes which is required, parental training methods. Then we have to go for psychotherapy. Then we have to go for cognition therapy, behavioral therapy, occupational therapy. So these are all part and parcel of treatment principles in case of ADHD. Behavioral modification should be also done. So these are all the planned process. These are all 1 day or 2 day process. It's a planned process. It requires a lot of planning and execution. Now, one more thing is food, sugar, and food additives are considered as one of the causes for ADHD according to some research. So, no much proof so far, but still, it is better to avoid excess amount of the sugar and food additives in the food. Now, psychostimulants, some of the psychostimulant drugs can be also given. One of the drugs which are supplementing is dopamine. Apart from that, psychostimulants can be given like methylphenidate, dextroamphetamine, tom, and then primoline, etc. So similarly, antidepressant treatment can be also given. Alpha 2 agonist, clonidine, etc. They can be given. But all these drugs will have a lot of side effects. The use of these drugs will have adverse effects like or side effects like irritability, insomnia, loss of appetite, then tics disorders, then growth impairment, etc. Although ADHD causes impairment in attention, many people with the can have a sustained attention for the task they find interesting or rewarding. This is called as hyperfocus. ADHD, there is a problem related to attention, but you find such a certain group of kids where they have got very good amount of sustained attention for the work that they want, willing to do, or which they found interesting and rewarding. So while performing such action, they do have very good sustained attention. But for some other works, they don't have the attention. So this kind of patients also will get while dealing with the ADHD. Now, of course, this case we will first see, and through that we can try to understand some of the basic principles related to the ADHD, and then we'll try to see some of the further. So far we have discussed the basic principles of treatment, basic pillars of the treatment. Now we need to discuss it in detail. We have not discussed in detail, we only mentioned. Now let us go for a case that try to understand the problem very from the basic level. So the case is a 9-year-old child, a 9-year-old male child. By the age of 4 years, the parents reported the history of inattention, impulsivity, disorganization, memory difficulties, emotional outburst, and as well as food and tactile aversions. Parents state that child is always have been an awkward looking. This is the version of the parents. Parents say that child is always awkward looking, he is not normal looking. And regarding the social interactions, a reciprocity, and always want to be in change, rather in charge. That means he's always moving here and there. Motor activities increased, clumsy, and easily frustrated he is, and with the episodes of aggression, and continue to suck the thumb and chew the clothings always. Then over the last 16 months, he has progressively become withdrawn. Okay, now child is 9-year-old. Father, parents noticed this problem since 4 years only. But now since last 16 months, almost 1.5 years, he's progressively become withdrawn and there is poor sleeping habits also. The patient was reported at the age of 7 years and diagnosed with ADHD. At the age of 7 years, the child was diagnosed with ADHD by the pediatrician on teacher survey and parents information, and he has been given with various medications. Currently, he is not in any medications, of course, except some of the sleep agent and clonidine. Mother has removed the wheat, gluten, and soya bean from the diet by thinking that there may be some relationship with the autoimmune pathologies, etc. And there is increased consumption of the chia seeds. 37-year-old, now talking about the father and mother, the 37 year is the age of conception of the mother with uncomplicated pregnancy, and there has been some moderate stress due to repeated viral infections, allergies, asthma, and depression to the mother. Now, medication during the pregnancy includes some of the metformin, progesterone, and Benadryl, etc. And there is good weight gain and developed gestational diabetes. There is a very good weight gain, but mother developed gestational diabetes. In 36 weeks, there is an emergency and underwent a LSS due to placental insufficiency. Now, if we look at the developmental history, mother is delivered at 37 weeks. There's emergency LSCS, and birth weight of the child is 4 kg because child had gestational diabetes also, with low blood sugar and Apgar at 7. It's quite common, low blood sugar immediately after birth in case of gestational diabetes, hypoglycemia after birth. So later adaptive skills he met with a timely fashion. All the adaptive, these fine motor functions and all, he met in a timely fashion. Communication skills also met in a timely fashion, but with the tongue protrusion issues, a small and also small maxillary arch, he has got some feeding problem. Otherwise, things are okay. Motor skills delayed compared to the peers. Play and social skills are normal, and pre-academic cognition is also normal. That means the preschool age. Parents say temperament of the child between the age of 3 to 5 years is quite active, social, happy crying, happy living and enjoying, crying sometime irritable, hypersensitive, curious, and also playful. Dominantly, the child is left-handed person. If you look into the social history, parents was one of the two children in the same household where they resides with both parents, and is a school-aged boy with no close friends. This is the social history. However, he gravitates towards the interacting with the younger kids. He's quite comfortable with the younger kids, but kids of the same age and elder kids, so he used to have some social withdrawal. Currently, he does not participate in an organized sports or any type of physical activity. He spends 4 hours daily on screen time, mobile, TV, etc. The patient is permanent resident and denies the traveling everywhere, anywhere. So child is not interested to travel anywhere. Okay, so there is no exposure to alcohol, tobacco, or any other mind altering medications. At this time there is no use of caffeine also. Mm, so this is exactly the history goes like this. When you see a case of ADHD, how it starts, how it proceeds, how it complicates. Okay, so this history has been given for this purpose. How you have to, what are the different things they have to. So we have taken in consideration of the antenatal histories, maternal habits, and disorders of the mother. That's diabetes mellitus. It has also what's its influence. Then mother is having stress during that, and different attacks of viral infection is also there, and all these facts will have their role in the development of ADHD. To highlight all these things, this case has been given, and this case is given just to say that uh, that autism is usually diagnosed at the early part, whereas ADHD is developed at the later part. Okay, ADHD is a basically diagnosis of preschool or school going age, whereas autism is diagnosed at the earliest, either in the second year, third year, etc. But unlike autism, ADHD will be developed diagnosed usually at the school going, or because his problems will be quite clearly understood only when he start going to school. There he need attention, there he need activity, there he need to sit somewhere, and he needs some social activity. So by that time he is clearly diagnosed. Okay, so therefore after the age of 7, in this case he was diagnosed as ADHD. Okay, although parents had got some clues regarding awkward looking, etc., but actually he's diagnosed at that particular age. So this show that this case has been given. So this is how we have to take the history of a ADHD patient. So ADHD is a chronic condition including the attention difficulty, hyperactivity, and also impulsive traits. This we know, that we have seen this. ADHD is often begins with the childhood and may persist into the adulthood, and it may also contribute to the low self-esteem and troubled relationships and difficulty in schoolwork. Just a revision, this is. And symptoms will be persistent patterns of inattention, hyperactivity, impulsivity, etc. Causes of ADHD we have also seen. It may be temperamental related, it may be environmental related. Okay, so we need to understand ADHD as a cluster of symptoms rather than a psychological disorders. ADHD may not be called as psychological disorder. It's a neurobehavioral and a neurodevelopmental disorder rather. So it may not be a psychological disorder. It's a cluster of symptoms. The most common drivers of the ADHD are genetics, environmental influences, diet, and lifestyle. This part we have already seen. And inattention, how to identify the inattention, this also we have seen. Hyperactivity also we have seen in the last class. Now come to the other part of the treatment. The superficial part of the treatment we have completed. In between we have gone through a case to make the things very clear, and now we come to the other part: occupational therapy intervention and assessment. Now this is very important. This includes developmental self-regulation skill. In the occupation therapy, usually we will go into teach the developmental self-regulation skills, sensory integration. When the child is in the uterus, when the mother moves, the fetus also move from one place to another, isn't it? Inside the uterus. When the mother turns, fetus also inside the uterus, it turns inside the boundaries of uterus. Then it stimulates the vestibular reflex. When the baby put the legs against the uterine wall, it stimulates the proprioceptive receptors, and also the touch receptors are stimulated. Okay, so quite interesting. And one of the common cause of ADHD is low birth weight in the preterm. Okay, common cause of ADHD, as we discussed earlier, either the low birth weight or the preterm delivery. This is one of the most common cause. In this case, fetus is immature, and the development of these sensations, what we have discussed in the last slide, like fetus turns, vestibular reflexes, touch receptors, proprioceptors. So these are not completely manifested or formed because the child is either premature or low birth weight. So gradually we see the symptoms of ADHD in coming days later. So then we have give more stress to develop these three sensations. Therefore, child will have problem with these three sensations in ADHD. Basically, organization and planning, fine and gross motor skills, and independence in day-to-day work. So this is the main three motto of occupational therapy. So we want to teach the child regarding organization and planning. Then fine and motor skills, gross motor skills we have to stimulate. Then we have to make the child independent in day-to-day activities. That is the three important goal of occupational therapy. So these three sensations like this proprioceptors and all those things, that will be affected, especially in preterm and low birth weight baby. So we have to give more importance for that part also when we find the history of low birth weight and prematurity. Now there is a very interesting concept called sensory diet. So what do you mean by sensory diet? And this is the schedule of the activities aimed at keeping the child nervous system calm and alert. That means by keeping to keep the optimum arousal level of the nervous system of the child. So okay, what is this? If the child is over aroused, then calming activities should be done, and if the child is under aroused, then altering activities should be done. Okay, so sometimes child is under aroused in the morning hours and over aroused in the evening hours. The environmental modifications to regulate the stimulation should be also done. A bright light if the overactivity, and then we have to do the environmental modification. Now, the arousal method we have seen. Now, environmental modification is also required to regulate the stimulation. A bright light, if overactivity, then you have to put the bright light, and then we have to do the environmental modification. As the child becomes elder, then it learns to read its own arousal levels and self-regulating stimulations. This sensory schedule should be followed till the child's adolescence age. And after this age, child understand his own arousal status like anxiety, dullness, etc. and he can convey it to you. So short sensory break from the situations. What are the different calming activities to the child when it is overactive? Most of the time overactivity is biggest problem in ADHD. So what are the different calming activities? Deep pressure or deep massage. This can be done deeply. So we can go for deep pressure and deep massage. This can be done by deeply hugging the baby, or sometimes by doing the oil massage during such overexcitation, and pillow pressure, etc., or rolling over the pillow or balls, etc. Okay, these are quite useful. Abhyanga is stored, oil massage is stored, so we can follow the Abhyanga also. So sitting on the bean bags. So bean bags are nothing but the large body pillows. A boy is inside that pillow and he is continuously moving with that, and this also gives the pleasure, and this also gives the pressure and a lot of proprioceptive stimulation. That means actually boy is dipped inside the pillow. It is like situation. So from all the four sides, it gives the pressure and also proprioceptive stimulation. And child is also pleasurable, and child is also playing, and child is also get benefited. So sandwiching the pillow press. That means sandwiching the pillow press to that means making the baby to play in between the two pillows. So that boy is sandwiched, so that the sensory stimulation will be there. Then you can use the lap pads, and deep pressure or the weight vest can be used. Then bear hugs or neutral warmth and slow rocking. These methods can be also followed. Lotion rubs. Ask the baby to apply the lotion to his body and also gives the pressure to the body. Just like oil massage. Instead of that, you can go for Abhyanga. Soft lighting should be done, and soft slow music can be also played. So these are very good to make the baby cool and calm. What are the calming activities to the child? Again, joint compressions can be done. Joint compression, stretching exercise can be done. Then chewing gum can be given. Sucking activities, fidget toys, then calm rhythmic movement pattern, physical relaxation exercise, and wrestling the child with the by the pillow. In the daily life, ask him to carry some heavy items like heavy books and heavy chair, etc. This causes the deep pressure. So anything which causes the deep pressure, that has to be given. Certain tactile deep pressure activities, for example, brushing. Okay, so hand massage, pillow press, sandwiching, neutral wrap, lotion rubs, etc. Snugging in the blankets, pillow bedding, rubbing with the different textures, finger painting, etc. Water play. That means those things which gives a deep pressure, that has to be given. Finding the objects in the rice, finding the objects in the rice, so that also helps. Sand beans, then painting with shaving cream and whipping cream, and making the sand castle, mud piece, and feeling different textures. Now, what are the general rules? So deep pressure to calm down. Effect of the deep pressure and the proprioception will last for 2 hours. So give it for every 90 minutes. Proprioception to get organized. When we have doubt about the alertness and calmness for proprioception, it will organize, like animal walking, bear walking, or pushing the wall and pushing the chair, etc., and bouncing on the bed, etc. Then vestibular stimulation to alert. Effects of the vestibular stimulation can last for 24 hours. So to increase the effect of deep pressure and proprioception, combine it with the vestibular exercise. So when we are using the vestibular stimulus to get the alert, use it with the proprioception to organize. Now, strategies to improve the attention of the child. Give a clear one-step direction to the child. Then teach the students to check in and themselves. Incorporate the movements during the lessons. Give the brain breaks in between the lessons. Set a timer for work sessions. Provide the fidgets and teach how to use them. Use visuals as reminders and supports. Provide the flexible seating options. Play attention boosting game and incorporate the hands on the learning games and activities. Use the student interest in the lessons. Use a chain before giving the important information. Usually we have some of the parents question. Parents question is most commonly asked. Parents question is, does the medications are required in this case or only therapy is sufficient? If required, why it is required? Answer is, before answering this question, we should know that why ADHD is happening. We have a neuron which contains a synapse, so which contains the neurotransmitter. Between these two synapses, there will be transfer of the neurotransmitter. In ADHD patient child, the neurotransmitter transfer is not happening fully. So sometime, hello, namaste. एक मिनट एक मिनट. So in ADHD child, the neurotransmitter transfer is happening fully. Sometimes the particular chemicals like dopamine and noradrenaline are depleted, and deep pressure will increase the serotonin level, so child will calm down. So in ADHD child, the neurotransmitter transfer is not happening fully. Sometimes particular the dopamine or noradrenaline are depleted. So deep pressure will increase the serotonin level to the child and the child will be calmed down. So medications will help to complete transfer of the neurotransmitter, but sometimes there may be some adverse effects. So treatment of ADHD by different therapy will go into help in the society, school, and also at the home. The right plan can help with all these major components of the ADHD. So that is inattention, impulsivity, and hyperactivity status. The goal of treatment is to help our child to follow the rules, concentrate, and to have good relationship with the parents, teachers, and the peers. So these treatment options have been evaluated for safety, but No two children are alike, and what works for some kids may not work for the others. So, what is the future effects and quality of the child in future child with ADHD? This is again importantly asked question. Get it diagnosed as early as possible. So, start intervention as early as possible. Then parents should get themselves educated about the diagnosis, give the positive respect to the child, embrace the situation. Every ADHD child is different. With early diagnosis uh, uh, and the therapy, life will be much better. So children with ADHD will need consistent rules that they can understand and follow. Make the rules of behavior for the family simple and clear. And regular physical exercise should be given and provide the creative outlet for the ADHD child. So with this we complete. Thank you very much. We will meet again. Thank you.